Hello students, subscribe the Fundamental Pharmacy and press the bell icon for more videos.
Hello students, join our online course for GPAT Niper Drug Inspector to get assured amazing rank.
Hello my dear students, welcome back to the Fundamental Pharmacy. Today we are going to see another classification, that is classification number 27. Antibacterial drugs, antibiotics and chemotherapeutic agents. Now, all these terms are the same terms. This classification is very important for your GPAT, Niper, Drug Inspector and Government Pharmacist exam. So it's my request to you, please watch this video until end. My dear students, we have already seen 26 classification videos. If anybody has not seen previous classification videos, please go in the channel's playlist and watch all the previous classification videos, because these videos are very important for your GPAT, Niper, Drug Inspector, Government Pharmacist exam. And believe me, lot of MCQs they are going to be covered by just watching these videos, because in those videos I have not explained you only classification, but also I have told you regarding the other important points for these exam. My dear students, first of all, you should know what do you mean by chemotherapy. Chemotherapy is the term was coined by Paul Ehrlich. Chemotherapy was the term coined by Paul Ehrlich. This will be the probable question in the exam. Now, what do you mean by chemotherapy? It is a study of drugs which destroys or kills the microorganism without affecting the host cell. Now, microorganism, if you got some kind of infection like throat infection or GIT infection or the UTI, urinary tract infection. So microorganism or pathogenic microorganism, they have entered in your body cell. So your cell is known as a host cell. So antibacterial drugs, they destroys the microorganism, they kills the microorganism, but will not affect your cell. And this chemotherapy term is used for the antibacterial therapy, and also sometimes it is used for the cancer therapy. You should not get confused between treatment of cancer. Sometimes it is also known as a chemotherapy, but chemotherapy, the term was originally designated to use of antibacterial drug. Okay, you may have one doubt in your mind that if drug is able to kill the bacterial cell, then why it is not killing your own cell. तो अगर ड्रग बैक्टीरियल सेल को किल करता है तो आपके सेल को क्यों नहीं करता? आफ्टर ऑल बैक्टीरिया कहाँ पे है? आपके सेल में है. So there is a reason behind that. So reasons for selectivity. So these antibacterial drugs, they have higher selectivity or high selectivity to the microbial cell, and they will not affect your host cell. What is the reason? The first reason is nothing but the bacteria will have cell wall. So bacterial cell will have cell wall, but human cell will not have cell wall. तो बैक्टीरिया के सेल के ऊपर सेल वॉल होता है, ह्यूमंस के सेल के ऊपर सेल वॉल नहीं होता है. Drugs like penicillins, cephalosporins or antibiotics like penicillins, cephalosporins, they selectively target the bacterial cell wall, not human cell wall. That's why they kills the bacteria and leaves your host cell unaffected. Okay, second reason for that, sensitivity to the enzymes. Means there are certain enzymes in the bacterial cell wall which are very sensitive to chemotherapeutic agent or which are sensitive to antibacterial drug. तो बैक्टीरिया में जो एंजाइम्स है वो ज़्यादा सेंसिटिव होते हैं ड्रग्स के लिए, और आपके बॉडी के जो एंजाइम्स होते हैं वो उतने सेंसिटिव नहीं होते. सो देयर इज अ सेंसिटिविटी ऑफ एंजाइम्स. फॉर एग्जांपल, बैक्टीरिया नीड्स ए फोलिक एसिड फॉर इट्स मेटाबॉलिज्म, एंड दैट फोलिक एसिड इज सिंथेसाइज्ड बाय टू एंजाइम्स, फोलिक एसिड सिंथेटेज एंड फोलिक एसिड रिडक्टेज. नाउ दीज एंजाइम्स आर आल्सो प्रेजेंट इन योर बॉडी. आपके खुद के बॉडी में भी ये एंजाइम्स होते हैं, बैक्टीरियल सेल में भी ये एंजाइम्स होते हैं. But your cell can utilize already formed folic acid. Bacterial cell cannot utilize ready-made folic acid, so they have to synthesize them, and that's why these drugs selectively can target the bacterial enzymes and leaves unaffected the human cells. For example, sulfate drugs and trimethoprim, then methotrexate. These are the drugs known as a folic acid antagonist, or they inhibit the folic acid synthesis. Now, third reason for selectivity of antibacterial drug towards the microbial cell, difference in the ribosome. So there is a difference in the ribosomes of bacterial cell and human cell. जो बैक्टीरियल सेल होता है उसका राइबोसोम्स, एंड जो ह्यूमन सेल होता है उसका राइबोसोम. राइबोसोम मतलब आरएनए. सो देयर इज अ डिफरेंस इन द राइबोसोमल आरएनए ऑफ बैक्टीरिया एज वेल एज humans. So bacterial RNA is comprised of 70S. बैक्टीरिया का जो राइबोसोम होता है उसको बोलेंगे 70S. 70S क्यों बोलते हैं? बिकॉज S is nothing but the sedimentation coefficient. You have to remember this. Now bacterial ribosome is divided into two subunits. This 70S is comprised of two subunits, 30S and 50S. तो S means क्या है? Sedimentation coefficient. ये दो छोटे यूनिट्स होते हैं 30S and 50S, जिससे बनता है आपका 70S राइबोसोमल सबयूनिट, राइट? दैट इज व्हाट बैक्टीरिया. बैक्टीरिया का राइबोसोम जो होता है वो 70S होता है. नाउ ह्यूमंस में राइबोसोम इज ऑफ 80S. जो ह्यूमंस का राइबोसोम होता है वो होता है 80S. ह्यूमन राइबोसोम इज 80S, राइट? नाउ 80S is composed of 60S subunit and 40S subunits. So antibacterial drug which inhibit the protein synthesis like aminoglycosides, tetracyclines, they will act on ribosomes. So there is a definite difference in the ribosomes. Another reason for the selectivity is nothing but the different cytoskeletal structure and neurotransmitter release. तो बैक्टीरिया में जो साइटोस्केलेटल स्ट्रक्चर होता है या फिर रिलीज ऑफ न्यूरोट्रांसमीटर होता है, एंड ह्यूमंस में जो होता है वो उसमें डिफरेंस है. सो दैट्स व्हाई antibacterial drugs like for example anthelmintics means drugs used to remove the worms. So these drugs can target selectively the bacterial cytoskeleton and neurotransmitter. Now another reason for this selectivity is nothing but the ergosterol. Now this ergosterol is principally found in the fungus. जो फंगल सेल होता है उसमें ergosterol से कोलेस्ट्रॉल बनता है, बाद में सेल वॉल सिंथेसिस होता है. This ergosterol is very important for synthesis of fungal cholesterol. Now this is a target for antifungal drugs. Most of the antifungal drugs they act on a ergosterol. Another enzyme is there, mycolic acid. Mycolic acid is found in only mycobacterium, which is a which causes the tuberculosis and leprosy. तो mycobacterium, leprosy and tuberculosis ये दो बैक्टीरिया होते हैं. mycobacterium tuberculosis will cause tuberculosis, mycobacterium leprae will cause leprosy. तो ये दोनों में एक mycolic acid होता है. Now that mycolic acid is targeted by different drugs like isoniazid. Isoniazid targets mycolic acid, so it inhibits the synthesis of mycolic acid in the tuberculous bacteria, right? These are the different reasons for selectivity. Antibacterial drug सिर्फ बैक्टीरियल सेल को ही क्यों मारता है, उसके पीछे क्या रीजन से? ये रीजन से क्योंकि वहां पे डेफिनेट डिफरेंस है. किसमें? एक तो बैक्टीरियल सेल वॉल में और ह्यूमन सेल वॉल में डिफरेंस है. एक तो जो सेंसिटिविटी ऑफ एंजाइम से, मतलब ह्यूमंस के जो एंजाइम से दे आर लेस सेंसिटिव फॉर द ड्रग. बैक्टीरियल एंजाइम जो है वो ज्यादा सेंसिटिव होते हैं, राइट? डिफरेंस इन द राइबोसोम. ह्यूमंस का राइबोसोम 80S होता है, बैक्टीरियल राइबोसोम 70S होता है. डिफरेंट इन द साइटोस्केलेटल स्ट्रक्चर एंड न्यूरोट्रांसमीटर रिलीज, जो एंथैल्मेटिक ड्रग्स के लिए टारगेट है. ergosterol is a very important precursor for the synthesis of cholesterol for the fungal cell. जो एंटी फंगल ड्रग का ये है, क्या है? टारगेट है. नाउ mycolic acid is the target for certain anti-tubercular drug like isoniazid. यहाँ पे आपकी कम से कम 2-4 क्वेश्चंस तो एटलीस्ट कवर हो जाएंगे. We'll see little bit history. So penicillin was discovered by Sir Alexander Fleming in 1935 upon the observation that certain molds, penicillium molds prevent the multiplication of staphylococci. तो स्टेफिलोकोकाई का मल्टीप्लिकेशन कौन प्रिवेंट करता है? देयर इज वन सब्सटेंस व्हिच इज प्रोड्यूस्ड बाय मोल्ड्स ऑफ पेनिसिलियम. पेनिसिलियम क्या है? फंगस है. उसकी कल्चर में पेनिसिलियम ने कुछ ऐसा कंपाउंड, ऐसा केमिकल रिलीज किया जो स्टेफिलोकोकाई का ग्रोथ इनहिबिट करता है. एंड लेटर ऑन दैट वाज आइसोलेटेड एंड इट वाज नेम्ड पेनिसिलिन. नाउ आफ्टर दैट स्ट्रेप्टोमाइसिन वाज डिस्कवर्ड बाय वाक्समैन. Streptomycin was discovered by Waxman in 1944. 1950 में टेट्रासाइक्लिन्स, क्लोराम्फेनिकोल, पॉलीमिक्सिन, बेसिट्रासिन, नियोमाइसिन ये भी ड्रग्स डिस्कवर हो गए. इंटरफेरॉन was discovered by Lessig and Linderman in 1957. So what is interferon? Interferon is nothing but the antibody produced against the viral infection. तो जैसे बैक्टीरियल इन्फेक्शन अगर होता है उसमें एंटीबॉडीज बनते हैं, जैसे आपके इम्यूनोग्लोबिन्स IgM, IgG, IgA like that. बट अगर वायरल का इन्फेक्शन होता है और उसके अगेंस्ट में जो एंटीबॉडी बनता है उसको बोलते हैं अपन इंटरफेरॉन. इंटरफेरॉन, इसके दो टाइप होते हैं, अल्फा बीटा एंड गामा इंटरफेरॉन. नाउ we'll see few terms. What is meant by antimicrobial drug? So antimicrobial drug is nothing but a drug or chemical which inhibit the growth and multiplication or kills the microorganism, including antibiotics and chemotherapeutics. तो antimicrobial drug के अंदर क्या आता है, एंटीबायोटिक्स भी आते हैं एंड कीमोथेरेपेटिक एजेंट्स भी आते हैं. तो एंटीबायोटिक्स मतलब एंटीबायोटिक्स मोस्ट ऑफ द टाइम दे आर आइसोलेटेड फ्रॉम बैक्टीरिया और फंगस और you can say microorganism. So antibiotics they are obtained from microbial source, but chemotherapeutic agent they are synthetic in nature. ये लैब में सिंथेसिस है. For example, penicillin is an antibiotic and sulfonamides are the chemotherapeutic agent. Basic difference क्या है उसमें कि एंटीबायोटिक आपको बैक्टीरिया या फिर माइक्रो ऑर्गेनिज्म से ही मिलते हैं और कीमोथेरेपेटिक एजेंट क्या है कि वो टोटली सिंथेटिक होता है, राइट. दैट इज द मेन डिफरेंस. नाउ व्हाट इज मीन बाय एंटीबायोटिक? Chemical produced by microorganism which are used to kill the or which are used to inhibit the growth of pathogenic microorganism. So antibiotic is nothing but a chemical produced by microorganism which is capable of killing and inhibiting the growth of other pathogenic microorganism. It is antibiotic. So most of the antibiotics they are obtained from microbial source, right? Now what do you mean by chemotherapeutic agent? So as I told you, they are the synthetic drugs. For example, sulfur drugs, they are a synthetic drug. Now next one is nothing but the antiseptic. So what do you mean by antiseptic? Antiseptic किसको बोलेंगे? So these are the chemical or agents they are applied on the living tissue to prevent the growth or to kill the microorganism. तो अगर आपको लिविंग टिश्यू पे कोई केमिकल या फिर कोई ड्रग लगाना है जो कि माइक्रो ऑर्गेनिज्म को किल कर सकता है, उसका ग्रोथ इनहिबिट कर सकता है, तो उसको क्या बोलेंगे? एंटीसेप्टिक. Now what do you mean by disinfectant? So this is again drugs or chemicals which are used on a non-living organism. They are used on a unanimate things. So if you want to kill the microorganism present on the desk, present on the floor, so disinfectant is used, right? So antiseptic का example क्या रहेगा आपका? So all the antibacterial drugs antiseptics. Disinfectant का जो भी केमिकल्स होते हैं जैसे फॉर एग्जांपल अल्कोहल, देन KMnO4, okay, then formalin, all these are the disinfectant, phenol, etc etc. So applied on a non living things. यहाँ पे याद रखना है एंटीसेप्टिक they are applied on a living tissue to prevent the growth or to kill the microorganism. Disinfectant they are applied on a non living things to prevent the growth or to kill the microorganism. Next term is nothing but the germicide. So those chemical agent which kills the bacteria but not necessarily kill the spores. तो germicide क्या होता है? It is again chemical which can kill the bacteria but not necessary to kill the spores. मतलब ये बैक्टीरिया को किल करेगा, स्पोर्स को नहीं कर सकता. For example, ethanol, iodine, that is germicide. There are another terms also like antiviral drugs. So they are active against the virus. Antifungal, active against the fungus, etc etc. Now another term is there MIC, minimum inhibitory concentration. In case of other drugs जैसे बाकी ड्रग होते हैं, we have seen, you might have seen in the previous sessions, minimum concentration of drug that is required to produce a pharmacological effect, that is known as a minimum effective concentration. So minimum effective concentration, MEC. So that is known as a minimum effective concentration. So minimum concentration of drug in the body which is required to produce a therapeutic effect known as a minimum effective concentration, MEC, for other drug. But for antibacterial drug it is a MIC, minimum inhibitory concentration. So it is a minimum concentration of drug or antibiotic which inhibits the growth of susceptible microorganisms, that is a MIC. Now efficacy of drugs they are expressed in terms of minimum effective concentration, but efficacy of antibacterial drug it is expressed in terms of MIC, minimum inhibitory concentration. You have to remember this, very important. What is meant by MBC, minimum bactericidal concentration. So minimum concentration of antibiotic required to destroy or to kill the bacteria, that is nothing but the minimum bactericidal concentration. So cidal, there are two terms, static and cidal. So दो term होता है bacteriostatic. Bacteriostatic मतलब क्या? Any antibiotic which will inhibit the growth of bacteria, that is known as the bacteriostatic. And bactericidal मतलब क्या? So any antibiotic that is able to destroy or kill the microorganism. That is known as cidal. So static means inhibit the growth, cidal means kills. We'll see the classification of antibiotics. Now antibiotics are classified in a different way. There are different ways to classify the antibiotics. So first way is nothing but the depending upon the classification of antibiotic, depending upon the activeness or active against which kind of organism. So if antibiotic is active against the bacteria, so it is known as antibacterial antibiotics. For example, penicillins, cephalosporins, penicillins, aminoglycosides, macrolides. So these are the effective against the bacteria, right? If antibiotic is effective against the fungus, so known as antifungal antibiotics, right? For example, the rhizophulvin, amphotericin B, ketoconazole, etc., etc. Now if antibacterial or antibiotic is active against the virus only, so it is known as antiviral drugs. So for example, amantadine, zidovudine, so they are known as antiviral drugs, right? If antibacterial drug is effective against protozoa, so known as antiprotozoal antibiotics, or that you have chloroquine, then pyrimethamine, metronidazole, diloxanide, fluoride. Okay, now anthelmintics means those are the drug active against the worms. Example, metronidazole, albendazole, diethylcarbamazine, then parental palmoate. Antibiotics are classified in a different way depending on activeness. They are active against which organism? Active against the bacteria, known as antibacterial antibiotic. If it is active against the fungus, known as antifungal antibiotics. If it is active against the virus, it is known as antiviral antibiotics. If it is active against the protozoa, antiprotozoal antibiotics. And if it is active against the worms, known as anthelmintics. Now again, according to the therapeutic index, they are classified into different types. So this classification again very important. So according to therapeutic index, what is therapeutic index? Therapeutic index क्या होता है कि it is a ratio of ED50 divided by LD50. Effective dose in the 50% of population divided by lethal dose in the 50% population. That is known as the therapeutic index. On the basis of that, so antibiotics are classified into different types. So antibiotics having high therapeutic index. So antibiotic having high therapeutic index. Example is nothing but the penicillins, cephalosporins, microlides, antibiotics. So these antibiotics, they are known as the antibiotics having a high therapeutic index. Now these drugs are relatively safe. So जो भी एंटीबायोटिक है इसका therapeutic index ज़्यादा है तो वो safe ज़्यादा होता है. Therapeutic index is nothing but the margin of safety. So in case of high therapeutic index drugs like penicillin, cephalosporins, macrolide, they are relatively safer. Now low therapeutic index antibiotics. So in that you have aminoglycosides. Okay, aminoglycosides. So they are known as a low therapeutic index antibiotic because they damages your kidney, they damages your 8th cranial nerve. So they have kidney toxicity and deafness as an adverse effect. So aminoglycosides में आता है आपका जेंटामाइसिन, जितने भी माइसिन्स होंगे, जेंटामाइसिन हो गया आपका, स्ट्रेप्टोमाइसिन हो गया, all these are the aminoglycosides. So they damages the 8th cranial nerve, deafness कर सकते हैं. Tetracyclines are also a low therapeutic index drug. So they have liver toxicity, kidney toxicity. They are teratogenic in nature. They have anti-anabolic effect. So they are having no low therapeutic index. Right? Chloramphenicol is also low therapeutic index. Okay. Bone marrow suppression, aplastic anemia. That is the adverse effect. जो high therapeutic index वाले हैं penicillin, cephalosporin and macrolide. Low therapeutic index वाले वो हैं aminoglycoside, tetracyclines and chloramphenicol. And very low therapeutic index वाले वो हैं very low therapeutic index. So polymyxin B, it has a neurological toxicity and renal toxicity. Then vancomycin, it causes hearing loss, kidney damage. Then amphotericin B also causes kidney damage and bone marrow and neurological toxicity. तो ये जो तीन है polymyxin B, vancomycin, amphotericin B, ये very low therapeutic index drug है. तो high therapeutic index, low therapeutic index and very low therapeutic index. So again we will see the next classification. So classification of antibiotics depending upon the mechanism of action. तो उसमें देखो first antibiotics which inhibit the cell wall. Okay, so bacterial cell wall inhibitors. In that you have penicillin, cephalosporin, cycloserine, vancomycin and bacitracin. तो ये ड्रग क्या करेंगे, सेल वॉल को सिंथेसिस नहीं होने देंगे. नाउ दोज ड्रग्स व्हिच कॉजेस द लीकेज ऑफ द मेम्ब्रेन, सेल मेम्ब्रेन leakage causing. So there are certain antibiotics which causes leakage of cell membrane. इसके ऊपर क्वेश्चन आ चुके हैं. सो एग्जांपल इज पॉलीपेप्टाइड एंटीबायोटिक्स लाइक पॉलीमिक्सिन, कोलिस्टीन, पॉलिन एंटीबायोटिक लाइक एम्फोटेरिसिन बी एंड निस्टेटिन. तो याद रखो पॉलीमिक्सिन, कोलिस्टीन, पॉलिन एंटीबायोटिक लाइक एम्फोटेरिसिन बी एंड निस्टेटिन. सो ऑल दीज आर द एंटी फंगल ड्रग्स जो है एंटी फंगल होते हैं एंड ये causes the cell membrane leakage, inhibition of protein synthesis. So tetracyclines, chloramphenicol, macrolide antibiotics, then clindamycin, linezolid. So all these they inhibit the protein synthesis by binding with the 30S ribosome or by binding with the 50S ribosome. Antibiotic causing misreading of mRNA code and affect the permeability. So aminoglycosides and streptomycin, topramycin, gentamicin, they causes the misreading of mRNA code during the प्रोटीन सिंथेसिस. तो प्रोटीन फॉल्टी बनेगा और बैक्टीरिया मर जाएगा. ठीक है. डीएनए गायरेज इनहिबिटर. सो दिस इज अ क्लासिफिकेशन अकॉर्डिंग टू द मैकेनिज्म ऑफ एक्शन. डीएनए गायरेज इनहिबिटर all the fluoroquinolones like nalidixic acid, ciprofloxacin, flocin, ofloxacin, moxifloxacin, all these are the DNA gyrase inhibitor or they are also known as a topoisomerase inhibitor. तो देखो इसमें बहुत सारे क्वेश्चन कवर होते हैं आपके. Again, those drugs which interfere with the DNA synthesis and function. So rifampicin and metronidazole they interfere with the DNA function. So those drugs which interfere with the DNA synthesis like acyclovir zeroudin. So acyclovir zeroudin क्या करते हैं? DNA नहीं बनने देंगे. किसका? वायरस का. So they are antiviral drug. Now those drugs interfere with the intermediate metabolism. So they are also known as anti-metabolite. उसमें आएगा आपको sulfonamides, trimethoprim, ethambutol. So they interfere with the intermediate metabolism, right? Now classification we will see again. Suppose this is your bacterial cell, this pink part is a bacterial cell wall. Now this is known as the ribosomes and this is your genetic material of bacteria, DNA. Those antibiotics which inhibit the cell wall synthesis. तो इसमें क्या क्या है? सेल वॉल सिंथेसिस करने इनहिबिट करने वाले एंटीबायोटिक्स कौन है? बीटा लैक्टम एंटीबायोटिक्स. इन दैट यू हैव पेनिसिलिन, सेफलोस्पोरिन, कार्बापेनम, मेरोपेनम एक्सेट्रा एक्सेट्रा. देन वैंकोमाइसिन, साइक्लोसेरिन, बेसिट्रासिन, पीसीबी, पेनिसिलिन, सेफलोस्पोरिन. ठीक है. Some antibiotic which will damage the bacterial cell membrane. So in that we have seen polymyxin and amphotericin B and nystatin. DNA gyrase inhibitors or fluoroquinolones, they will prevent the supercoiling of DNA and this supercoiling should be relieved after the opening of double stranded DNA. जब replication होता है आपका तो उसमें double stranded DNA का opening होता है single stranded DNA और एक साइड से वो खुलते जाता है, एक साइड से zip opener एक साइड पे ओपन करते रहते. After the completion of replication, that coiling must be relieved. That is there is a function of DNA gyrase. So DNA gyrase will relieve the supercoiling caused after the replication. Now that is prevented by fluoroquinolones, right? Now DNA function. So rifampicin will affect the DNA function. Tetracyclines, chloramphenicol, aminoglycosides, erythromycin, clindamycin. These drugs they will bind to ribosomal subunit and prevent the protein synthesis. Sulfonamides, sulfons, trimethoprim, methotrexate, they are known as they inhibit the intermediate metabolic pathways of bacteria. जो होता है पाबा से बनेगा आपका folic acid, that is very important for bacterial cell. It is inhibited by this drug sulfonamide, sulfon and trimethoprim. We will see this classification again. Bacterial cell first is nothing but the folate synthesis inhibitor, or these are the drugs which inhibit the intermediate metabolites. Sulfonamides, methotrexate, trimethoprim. So they prevent the formation of folic acid, the PABA dihydropolic acid, tetrahydropolic acid. Now these steps they are blocked by this sulfur drugs and methotrexate. DNA gyrase inhibitors or quinolone antibiotics inhibit the DNA gyrase and which will prevent the relieving of supercoiling and that kills the bacteria, right? Now those drugs which affect the cell membrane synthesis. So lipopeptides they inhibit the cell membrane synthesis. So microbial cell wall synthesis inhibitors. So cephalosporin, penicillins, glycopeptide, fosamycin, bacitracin, alkosulfalcin. Okay. Now you can see this A B C G F P. ठीक है. A B C मतलब अपन होता है consider A B C का है and G F मतलब आपका गर्लफ्रेंड. B C G F P. A B C का गर्लफ्रेंड बहुत ही पैसे वाला है. B C का गर्लफ्रेंड बहुत ही पैसे वाला है. A for alaphosaphallin, okay, alaphosaphallin A. B for bacitracin, C for cephalosporin, A B C. ABC का गर्लफ्रेंड GF मतलब गर्लफ्रेंड, so G for glycopeptide, F for fosamycin, and both पैसे वाला मतलब penicillin, right? So you can also remember this. Microbial cell wall synthesis inhibitors, very important है, सबके ऊपर क्वेश्चन आ चुका है. Those drug which inhibit the DNA dependent RNA polymerase, so rifampicin. Right? Now, protein synthesis inhibitors like tetracyclines, aminoglycosides, macrolides, lincosamide, and oxazolidine diols. So they bind to either 30S or 60S or 30S ribosomal subunit and inhibit the protein synthesis. We'll see the classification again once more. So antibacterial drugs again classified according to the mechanism of action. So those antibiotics which inhibit the cell wall synthesis. So in that you have penicillin, cephalosporins, carbapenems, monobactams, vancomycin, cycloserine and bacitracin. पेनिसिलिन, सेफलोस्पोरिन, कार्बापेनम, मोनोबैक्टम, ये सब में क्या है, सिमिलर रिंग है, बीटा लैक्टम रिंग. ये जो पेनिसिलिन, सेफलोस्पोरिन, कार्बापेनम, मोनोबैक्टम, so all these will have same ring like a beta lactam ring. So that's why they are known as beta lactam antibiotics. They inhibit the cell wall. Vancomycin is there, then cycloserine, bacitracin. Those antibiotics which cause leakages from the cell membrane, इसके ऊपर क्वेश्चन आ चुका है. So all the antifungal antibiotics mostly, polymyxin, polystine, bacitracin, and amphotericin B. So polyene antibiotics and polypeptide antibiotics. So they causes the leakage from cell membrane, right? Now next one is antibiotics which inhibit the protein synthesis. So tetracycline, chloramphenicol, erythromycin, along with the other macrolides. So chloramphenicol guy, it is a broad spectrum antibiotic obtained from Micromonospora purpura, right? So chloramphenicol, it is a nitro containing compound. इसमें नाइट्रो ग्रुप होता है, so it is a para nitro compound. Okay, then tetracyclines, they are also, they are teratogenic in nature, they are anti anabolic effect. Okay, clindamycin linazolid, antibiotics causing misreading of mRNA which affect the permeability, right? So in that you have an aminoglycoside like streptomycin, gentamicin, neomycin, okay, like that. So other aminoglycosides, so they will have a aminoglycosides will have adverse effect of 8th cranial nerve damage. So they are a low therapeutic index drug. Aminoglycosides, tetracyclines, they are a low therapeutic index drug, right? Next class, that is class number 5, antibiotics which inhibit the DNA gyrase enzyme. In that you have quinolone antibiotics or fluoroquinolones, ciprofloxacin, norfloxacin, etc. So remember, यहाँ पे quinolone antibiotics, they have one adverse effect, they will damage your tendon, they will cause rupturing of tendon. इसके ऊपर भी क्वेश्चन आ चुका है. So DNA gyrase inhibitor or fluoroquinones particularly, they have a tendency to rupture your tendons. Now next class number 6, those drugs which interfere with the DNA function like repumping. Now class number 7, drugs interfere with the intermediate metabolism. In that you have sulfonamide, sulfone, trimethoprim. तो यहाँ पे सल्फर ड्रग जैसे sulfonamide, sulfones, trimethoprim भी सल्फर ड्रग ही है. So all these sulfonamides we have adverse effect like crystalluria उनका होगा. Crystalluria is because of the acetylated metabolite, because these sulfonamides are metabolized by acetylation reaction, and acetylated metabolite which is a less soluble in the water, and that's why it recrystallizes in the lumen of tubules in the kidney, and that's why causes crystalluria, right? तो ये याद रखो आप. Now sulfonamides can also cause Stevenson-Johnson syndrome, also are teratogenic in nature, right? Sulfones, trimethoprim, and then pyrimethamine. Pyrimethamine is a drug used in the treatment of malaria. Then para-aminosalicylic acid, it is a antifungal and keratolytic drug. Then metronidazole. These are the different classes of antibacterial drug. You can order this magic bullet for GPAT Niper, Drug Inspector Government Pharmacist exam. Read twice before the exam and qualify 100% with a very good rank. It's our guarantee, right? You can also join our GPAT Niper 2024-25 online test course, where you will have live lectures, recorded lectures, subject wise and chapter wise session will be there. Study material is available in the form of hard copy and online tests. Everything is in 8,000. And if you get all India rank below 20, your fees will be returned to you in the form of reward. We have very much promising result. As you can see, thousands of students, they are placed in the Niper.
Hello students, order the magic bullet for GPAT Niper Drug Inspector. Read twice and qualify 100%.